Hello, everyone. Welcome to Rewriting the Narrative. Mare, how are you? How's your narrative going this after morning, late morning?
Yeah, late morning. My narrative is chilly. I was just telling Sarah our heat, which is arguably probably a good time of year for this to happen, our heat is gone on the fritz. And we weren't sure if it was going on the fritz, but I think that if you question if your heat or air is on the fritz, it's on the fritz. And so I currently have a space heater going. We're very lucky because our home does have a gas fireplace. So that is
Okay.
a positive. Very handy right now. But I am chilly. When you go here, if I go to the gym to get warm, it's not a good thing.
Yeah, that's definitely a flag. Well, Florida is starting to warm up, so I won't dwell on it too much. Our last episode that came out at the time of recording this was on sleep. And I will say, like, I have been much more mindful of my sleep routine ever since we had that chat last week. So if you guys haven't listened yet, be sure to go back and listen to the last episode. I want to say it was episode 4 now, and this is going to be number
Yeah.
5. We're rolling. But
Yeah.
today, actually, so you guys, like Mare and I, we talk a lot. We collaborate a lot. Um, Even though we are separated by probably what 2,000 miles, I don't know, something like
A lot.
that. We're always communicating and always staying up with each other. And Mary reached out to me this week, frustrated about a topic that we are both very passionate about. And then you had actually a great follow-up post yesterday, which I don't think you knew you were following up with that comment, but just making the note that holding back details and not explaining nuance or not understanding nuance or details in health communication in general, like towards women, is just there's a lot of confusion out there, and a lack of information or not explaining nuances is dangerous, at times. And at best, it just, I think it makes women feel dumb, like, oh, I don't get all the information. Like, hello, like, we're all like we're smart freaking badass women, we can handle the information. So I am rambling now, but we wanted to talk about progesterone, specifically bioidentical progesterone. What even is that? Talking about hormone therapy, talking about progestins. Notice how I enunciated that I. So I'll let you kind of kick it off, Mare. There was, some dialogue on social media that kind of sparked this topic. So you explain.
Yeah. So what sparked this is, I think, a lot of confusion between, and maybe we can even talk about this, the natural versus synthetic. And I think that we both get it. Sarah and I get it, that we believe in, for example, single ingredient whole foods. That's obviously an apple is going to serve your body better than a Snickers bar, but we're not here demonizing that Snickers bar either. And I think that in the discussion of hormones, we have to be really careful because I think there also can be a lot of demonizing of natural versus synthetic. And I think that the words can be thrown around and not intentionally, mean, wanting anything malicious or any confusion. Arguably, there is a lot of confusion, and that comes down with the words natural versus synthetic, bioidentical versus synthetic, compounded versus FDA approved. And this is where I kind of get rattled because I feel like there is females' health is scary enough, confusing enough. And then when we extrapolate a sentence, and I don't want to be a word ninja, but if we extrapolate a sentence and we make it a statement, we have to be very careful it's a correct statement, or it can really be very misleading when you have so many things. And you actually made a really good point when you said, I enunciated this. I hope you hear the enunciation in this word. So if we go back to just the word progesterone. Progesterone doesn't really tell us enough any longer. So progesterone could be what's produced by the ovaries, what we're producing naturally in our body, or at this point in time, we can also be talking about actual hormone therapy. And this is where words like bioidentical progesterone come into play. And some providers will argue there's no such thing as bioidentical. That's just, gibberish. There's no medical term. And you know what? Arguably, they are right. However, for the sake of a dialogue and the sake of a conversation, there has to be some sort of delineation between what we're talking about. Otherwise, it gets very confusing. And so, for example, Sarah said progestin, and I just said progesterone. And both of these words are umbrellaed underneath one other word. And the bigger word is a progestogen. So basically, think progesterone, but put an O in the center of it. This one word, progestogen, could mean progesterone, bioidentical progesterone, progestin, which is a synthetic compound. And so this is where things can get very confusing, because even in literature, if you see the word progestogen, it could mean any of those things I said, unless you're really reading and getting very specific on what does this person mean. And the same thing I think is going around with the words compounded, because people are automatically associating compounded means natural. Natural is associated with bioidentical. So compounded bioidentical is better. And that is the only way I can get a bioidentical hormone. And that is so false. Somebody had sent me something and it said that the difference between FDA approved and compounded is FDA approved means it's synthetic and compounded means it's bioidentical. That is so false. It is like literally, it can't even be close to okay to say, because it's wrong. A FDA approved hormone therapy can be a bioidentical estrogen, or known as bioidentical estradiol, being specific. It can be a bioidentical progesterone. It can actually be a testosterone, and it can be DHEA. All of those are bioidentical, FDA approved. And here is the kicker, which is going to literally roll people's socks off. This bioidentical, FDA approved, all of these hormones, you can get at a compounded pharmacy. Rewind that, folks. Rewind it. Let me say it again. FDA approved bioidentical hormones, progesterone, estradiol, testosterone, DHEA, you can get at a compounded pharmacy. Other thing is compounded hormones are made from FDA improved, FDA. It's just when they compound it, they are changing the formulation. When you change the formulation or perhaps add something to it or put it in a different, again, changing the formulation, put it in a different base, it's not the same. So for example, Sarah writes a PDF. It's Sarah's language. It's her PDF. She's paid the gazillion dollars to have it copyright. I take that PDF, I read it, and I'm like, this is a badass PDF. I am going to throw a merism in here, and I'm going to rewrite it and pull out some things that I fucking love, but I'm going to add some things that are more in tune with my audience. Guess what? This is Sarah's stuff. I have changed the ingredients. It's now mine. However, if Sarah cited some information from good old PubMed science, guess what? That is also an ingredient she pulled in. Same thing happens when it comes to these bioidentical versus synthetic. And arguably, we probably could end the podcast here with just that one statement, but that's where a lot of confusion comes in. And the other thing is, when it comes down to synthetic versus not, doesn't it depend on the woman what's bad or good? Like, who are we to judge? Like,
well, can I,
yes,
if I may go there,
please, babe.
Do we think that some of this dialogue and some of these statements are driven because hormone therapy is becoming en vogue and it's becoming a very lucrative business?
Yes.
And we're seeing these clinics pop up and they do tote the words natural, bioidentical, this and that. This is, quote, better than what you can get from your doctor, is kind of the implication.
Absolutely.
Do you agree?
Absolutely.
I mean, that's my thought.
And my question to you is like, do we need any more confusion? Like, it's like, you know, it was like the movie Elf, when he like goes into that coffee shop, he's like, congratulations, you did it. You have the world's best coffee, or whatever it was. Like, and then you see the next coffee shop, it's like world's best. And like, do we really need that? Like, any more confusion telling women like, this is better, this is worse. Ooh, be scared, FDA approved is synthetic. Like, number one, it's wrong.
Well, okay, so I do want to give women some actionable stuff. So, well, not that that wasn't actionable, but Let's just have like, just clear the confusion. So like, let's say that like, I'm, coming to you and I'm looking for advice. My progesterone levels are low. I have all the symptoms, like we've done all the things. Like I am a candidate. I'm a good candidate for looking at hormone therapy. How would you like, what would you direct me to start with as far as like looking for that, looking for a provider to prescribe this? Because we're
Yeah.
not looking for black market progesterone, right? So please.
Let's just say it right here for this podcast. If you ever do not buy any hormones off of Amazon, I don't care if I get flagged, I don't care if whatever they say, do not buy your hormones off of Amazon or any foreign website. Please don't do that.
Or yeah, on your cruise in Mexico.
Yeah, let's not, guys. Oh my gosh, can you repeat what you
So okay,
said?
so
Sorry.
Mac,
Oh,
we've done this. Like I need some hormone therapy. Where am I looking?
yeah. Yeah. So by and large, if you are looking for hormone therapy, you are not looking for a synthetic hormone. The reason is a synthetic hormone like progestin is going to shut things down. It's going to block receptors. It is not designed, and I'm going to say this word, and Sarah can probably, I'll let you actually run on this tangent. It's going to block receptors. It's not designed to support fertility. Now, we may not want fertility. However, a healthy female body is arguably going to be supportive of that.
Mm-hmm.
So if you wanted hormone therapy, if you needed hormone therapy, and this is actually where a lot of confusion comes into place for a lot of women, because they think that if they start hormone therapy, it is going to work in the same mechanism as a man. So when a man, say a young man in his 20s, starts TRT, say he's got decent levels of testosterone, but he wants to get some extra levels of testosterone for whatever reason. So for a man, it will shut things down because of that feedback loop. And depending on all the things that we're not going to go into today, depends on when he comes off that TRT, whether that hormone production as well as sperm quality and stuff comes back. These are two separate things. You can have great testosterone, but your sperm quality, motility, whatever can suck. For a female, it is different. So for a female, she could be in her, say, early 30s and hormones can be suboptimal, not in a great place. But if she supports with hormone therapy, it's not going to be affecting, like, for example, her fertility with regards to ovarian reserve. That is very different. Declining ovarian reserve, we are not going to be regenerating that. Like, that is going to be declining as we age. At this point, 2025, we're not going to be regenerating that. But for a female, say in her early 30s, she can start some bioidentical hormone therapy because it's going to be supporting fertility, even though she does not necessarily want to have said baby. It's going to be supporting a healthy system. And that's where I think a lot of also confusion comes in, because a lot of women are scared to start hormone therapy thinking that it's going to put them in a chemical menopause. Arguably, that's actually what a birth control is kind of going to
Well,
do.
I was gonna say, like, so if we're talking about like progestin, back to what you were saying about like what you are asking for, a birth control is going to contain a progestin. And with that, again, we are giving hormones. Yes, a lot of doctors will present it that way. Like, let's give you some hormones. However, giving somebody hormones from a birth control isn't the same as giving them hormones that replicate what, a quote natural hormonal profile would be doing. So, and again, it's a birth control is going to be kind of quote shutting off that communication between brain and ovaries.
Yeah.
So,
Good.
yeah. So I was going to say, like, just for an example, and I don't want to get too off on a tangent. I'm just going to give a quick example and then you're going to go back and give the people what they want. If a female is in a state of hypothalamic amenorrhea, right? She's not having a menstrual cycle. Well, her progesterone is low, as is her estrogen. We can pretty much affirm that. If we give her a birth control that has a synthetic estradiol and a progestin in it, we are not getting the same health benefits that we would be getting from a from hormone therapy in the form of a bioidentical progesterone and estradiol. So she is not getting the benefits from a bone health standpoint, from a cardiovascular standpoint, from a sleep standpoint, I could go on and on from that birth control. Now, my birth control, I don't know, like, I'm not going to say that would be the wrong move. However, it is masking what is going on. So let's talk bone health. If we give somebody a birth control, now she just, we don't even know what her hormones are doing because we totally, cut off that communication between brain and ovaries. So, we're kind of like masking an issue. Whereas, if the conversation was like surrounding like, okay, we are working on addressing why you have hypothalamic amenorrhea, which we have podcasts on, or we have blogs on, you guys can read. It's, a lot of times, maybe a low energy availability state, thyroid, etc. If we are giving you support in the form of hormone therapy, we are giving your body a little bit of a boost while we work on those other things. And I think that's the best way to think about it. Whereas a birth control, now we're kind of putting you a little more in the hole. And we're kind of blind to what else, maybe even improvements, or, as far as like, as you work on maybe increasing your food or, addressing the thyroid, et cetera. So that's kind of like one, I mean, that is just one example of many. So back to like, let's say I go to my doctor and she's like, okay, yep, yes. I mean, is that where you would recommend a female go? It would be a gynecologist as a first step?
It's hard because I know like between you and I, like we have actual providers that we refer our clients to, but I'm going to say for the person who's listening to this, who hasn't done like say a one-time professional consultation with either Sarah and I'm going to say, I do believe in always opening the dialogue with either whomever your female health provider is. And for some women, it actually might still be their general,
their PCP. Yeah.
Yeah. And so I think opening up the dialogue, but and I said this yesterday, actually, opening up the dialogue with your provider and from a place of curiosity, a place of wonder, and just listening to what they say. What are their rationales of yes or no? What are their other suggestions? So for example, if say you're a female in your 30s or 40s and your concern is your bone health and you want to run your blood work and you would like to take a look at it, if they're dismissive of you about you're too young to worry about that, you don't need to do that till later in life, at this point in the game, this is where times have changed dramatically, where we used to believe that you had to wait for there to be a problem to actually be curious. And now we can actually say, you know what, that's cool. I understand that I can wait till then, but I'd like to actually look at this now because I want to be preventative as opposed to repairing things. So I would talk to your general provider first, talk to your gynecologist, and then I do think that unfortunately it does start to get into a little bit of the wild, wild west when you start to seek out perhaps a hormone therapy clinic, because there's a lot of telemedicine clinics. There's some that, Sarah and I work with that we love and adore. And there's some that I am a curious person. And I can say that before I have referred any of my clients to a provider, I have met with that provider before. So I have met with so many providers across Canada, across the United States. I want to hear what their belief is. I want to hear what their knowledge is, because there is still some providers don't believe in hormone therapy. There's also some providers, and I've been to these educational seminars where they're teaching, don't test blood work. Just if they're symptomatic, just give them more. Just keep giving them more. And I'm like, are you kidding me?
Yeah.
Like, when has that ever been the answer to anything?
Right. So, and then it goes back to, it's not where you find the provider. It comes down to the provider and their education and their knowledge base and their personality, and I think like if somebody is very black and white, or, they're not asking you questions, like if you come in and they're just like, okay, yes, here, that's probably a red flag. And I'm talking about a doctor. I'm talking about maybe a PA that you meet with online. I'm talking about, someone in customer service. I'm talking about all the things. So I think that's, really important, to just really make sure that you're comfortable with the situation and you do your homework before.
Yeah.
I'm just going to plug us. Like that's, what we do. I mean, very much so is we kind of act as support in that health communication. That's, what I see myself as is like a mediator isn't the right word, but kind of go between person, to say like, hey, like this is what I would be asking, this is, what did they tell you this? Can you ask your doctor this? Like, what was their thought process here? Like, et cetera, et cetera.
Yeah. Sorry, go ahead.
Oh no, I was just gonna say, and like, just like to give some people some like names that they might have heard. Like, let's just say, like, you do go, like, I go to my doctor, right? And she starts saying something like prometrium.
Yeah.
What does that tell me? Like, what is she giving me?
Yeah. So she's giving you a bioidentical progesterone.
Right. And which you can find out by Google, right, ladies? Like, let's also not be like ignorant here and like just take things. Like, I know
Yeah.
we're all better than that. Like, we can do our own, quote, research. That doesn't mean we know more than a doctor, but you have access to this information too. And don't be afraid to seek it out and, ask questions. So, prometrium, tell me a little bit more about that. Like, what might that look like as far as like dosing? And then how is that different than something like if we're talking about a compounding
Yeah,
pharmacy?
so I think they're gonna be really similar. I want to just like piggyback and then I'll get into that. Like Sarah and I are absolutely, I want to say we're facilitators. I think that we help our clients triage things so when they go into an appointment, they understand things that they're going to hear. So oftentimes when we have given you the introduction to something, then it's not as unfamiliar to you. So it flows better. You can hear things easier. I know for myself in an appointment, if I am overwhelmed, because let's be real, hormonal health is an overwhelming thing. You're in a doctor's appointment, that's very intimidating, depending on if I'm going to say it, if you have your pants on or not. Like all of these are situations that can be very intimidating for a female.
Yes,
Whether you're
having this conversation when your legs are up in the stirrups is a little
right,
awkward, right?
but it happens, right? So I think that for Sarah and I, where we come from is one, we want to look at your situation and we give you guys the rundown of all the things you have under your control. So your basic fundamentals of life and how important those are going to be with these next steps of that facilitation of hormone therapy. And so when you're talking to your provider, some things I suggest to my clients is tell them, ask them about bioidentical hormone therapy. That is what you're looking for, bioidentical hormone therapy. They may go on a tangent, like I mentioned earlier, that there's no such thing. I have now debunked that. It's nomenclature, there is. So ask them about bioidentical hormone therapy. Then you need to know what your options are as far as mode. And this is where this comes down to the individual. So for example, if we're talking about progesterone, typically we're going to be talking about an oral. So an oral bioidentical, so something like prometrium. Same thing if it's compounded or if you're getting your prometrium from a compounded pharmacy. So it's going to be an oral micronized, so a pill that you swallow. That said, you may be offered the same thing as a vaginal suppository. Does not make it better, does not make it worse. This really depends on your individual situation and the provider. I think probably a better, more well-rounded example would be something like an estradiol. So estradiol can be given orally. It's not something that I'm going to say is, I do not bias a oral estradiol because it does go through first pass effect through the liver. I typically prefer either something like a cream or say an injectable, but depending on who you are, what country you live in, and the the comfortableness and education of your provider, you may only be offered a cream or a cream and an oral. And this is again where I think that Sarah and I pop in and kind of help you understand the decision making. So for an example, pro and con to a cream, it's easy. You smack it on, easy peasy, lemon squeezy. The con is it can be a little bit daunting when you have to allow your body to kind of stand there and it absorb. Absorption becomes an issue from whether it's the clothing you wear, the timing you put on it after a shower, it's whether you sweat or not, your body fat distribution. These can really matter with regards to the mode selected. But say the provider only offers you a cream or an injectable, and you aren't comfortable giving yourself an injection. Number one, I'm going to tell you, ladies, you all can do it. It is easy. It's like a little bit like a little thumbtack size needle. It just goes in your skin. That's it. Maybe that is the deal breaker for you right now. That is the entry level that you are not willing to cross. So do we say, then fine, you don't get any hormone therapy? No, we say, hey, guess what, babe? You know what? We have these other options here. You can do a cream. There's also a troche, which is like a little lozenge. There's also a patch. There's also a vaginal ring. There's so many different forms of estradiol, depending on, again, your state, your country, the education of your provider. But you just need to know that if they offer you, say, a pellet, that is not the only mode out there. That is not and you have options.
And that's like what we try to do too, is like that facilitator or communicator is, hey, if this is what your doctor is offering you and this is what you would like to try as a first step, just know too, if it doesn't quote work, which that's a whole other, we're not going to get there, Mare. Don't go into that because we don't have time.
No, I'm not.
You have options, right? It's not you are a lost cause. And that goes for freaking anything. That goes for your training program, right? Like that goes for absolutely anything. There are so many tools and you just got to find the right ones for you, which aren't always going to be the same tools that you use inevitably or for the rest of your life, right? So that is the beauty of being human and where the overwhelm can stem from. I want to reel it back because a lot of this does come down to the individual and I don't want us to get too in the weeds. I would say blog articles, yes, we have that. Yes, we have some free resources on improving your hormone therapy experience. We have a webinar on birth control where we go, actually, Mare just like amazing like slides on exactly what we were talking about. So you guys can check all of that out on our website. I'll make sure I link it. But coming back to just tell us a little bit. So we talked about prometrium, which is commonly what is, what a doctor might prescribe. And I'm talking like just generally like speaking, like that's common. What about if I'm going, let's say I start this, right? Like I'm working with my doctor and let's say they give me the lowest dose of prometrium. I'm not even going to talk about what that is, but they give me the lowest dose and I'm on it for 3 months and it's just quote, not working for me. It feels like it might be too much. Again, it's hard for me not to go into more details. Mare as well. We'll have future podcasts on this if you guys are interested. What might my other options be there? Because you went over estradiol and I want to come back to progesterone. So let's say the 100 was too much. And that was from, prometrium, which was what my doctor gave me. What are my other options as far as maybe having access or seeking out a different progesterone?
So this is where I do think that a compounding pharmacy shines because you can get more nuanced in the dose. So if a quote FDA approved medication like prometrium, it typically comes in set dosing. Like you can't divide these suckers up, right? These are not like pills that you just snap. And so this is where I do think that a compounding pharmacy does shine because you can, one, change the mode. Using an oral prometrium, you know what? It could be as simple as just changing it to a vaginal prometrium, right? So using it vaginally would be considered an off-label use. Off-label does not mean wrong. It just means that that was not the quote designed use of it. Going with a compounded pharmacy, you can go ahead and also compound actual suppositories that may be a little bit more comfortable, maybe a little bit more easier to apply or
absorb.
Yeah, absorb, but they also can adjust the dosing. So I have had clients where we're talking about progesterone specifically, where 100 milligrams wasn't quite enough for them, and they evolved. Say they were at 100, and then we needed to do some adjustments. Then they actually found their sweet spot at like a 175, right? So I know that sounds silly, but it truly. The other thing with regards to progesterone that you mentioned specifically is this is where defining with your provider, what does it mean when you say it did not work or it's not working? Because a lot of symptoms do have crossover, and this may be a time where perhaps we don't need to adjust the progesterone at all, but perhaps your body has evolved. And with perimenopause or somebody who's going into that phase, typically progesterone leaves the picture first. Arguably, most people start with just progesterone. So not working could actually be needing to keep where it's at and bring something else in, such as estrogen, because we need estrogen to have viable and happy progesterone receptors. If we do not have enough estrogen, we will not be having bright, shiny, superstar progesterone receptors that are waiting to receive progesterone. So this is where having a dialogue with what doesn't work means to you, like actually putting that into language, which a lot of females and people in general, it makes them uncomfortable when I say, hey, what specifically are you looking for? Getting specific with your symptoms. What are you specifically looking to resolve or improve comes down to.
Yeah. And this is where I'm gonna end this here. I think we're gonna wrap it up. Because there's so much more nuance that we could go into, and it really does come down to the individual. That said, like, we guys, like, let us know, you guys, like, reach out, because we can kind of narrow in on more specific topics related to this. But coming back to what were you just saying, Mare? I totally lost my train of thought. I'm not even gonna lie.
About the progesterone, getting specific with your symptoms and what
Oh,
you're looking for to.
yes. Thank you. Timeline. Create a health timeline for yourself. So have notes, like when you start going into, like, if I was, this person going to my doctor, I would have notes of what I was looking to even achieve, first of
Yep.
all. My health history, any medications that I had been on, any birth control use, my fertility goals. I would kind of have some idea about that. And when I say fertility goals, I mean having a baby. What is, like, my seeking here? Just getting really clear on that. And you may not be super clear, but getting an idea of what you might be looking for here in the first place. And then as you go, making note of these appointments, and when you started certain things, when you stopped things, when you adjusted things, because all of that notation is going to help you as far as knowing what tool or how to adjust the tool for you to feel your best.
Nailed it.
And because I said that, and we talk about that a lot, just because we start hormone therapy doesn't mean we're going to feel our best all the time. Just like when we, quote, optimize our health doesn't mean that we're going to feel amazing all the time. We are human beings with human bodies that are, I don't know, like sometimes I look at us like compared to, like, I don't know, like a cheetah or even like a squirrel, and I'm like, we're so, like, helpless, like us naked, like we have no, like, the elements, like we hurt when we run, like whatever, like,
Yeah.
anyway, just saying, like, we're not after perfect, we're not after just never having to worry about this ever again, or anything like that. And you know what? Great, we're human. We're all the same, and it's not you, I promise. So don't worship the mighty should, and don't try to solve the problem that is being human.
Yeah. I'm just going to say, I think end on that is great.
Okay. Okay.
Yay.
Well, ladies, gentlemen, coaches, if you guys are listening, let us know. If you do have any more questions, or any topics that you'd like us to dive into, and we will see you next time, and keep rewriting that narrative.